Hello, welcome to this channel. If you're new here, you're very much welcome. This is Dr. Irabo, and on this channel, what we'll discuss is health for mothers and health for babies. If there is something you're interested in, join the family and let's dive right into today's video. And in today's video, we're going to be discussing cord care. How should you care for your baby's cord, your newborn's cord? How should you care for your newborn's cord? So when it comes to cord care, that's the umbilical stump. This is one area that is very, very crucial in newborns because if that site doesn't heal well, if it doesn't heal properly, it can put the baby at risk of infections, it can put the baby at risk of tetanus. So that site needs to heal properly. An infection arising from the umbilical stump area can be very, very severe. They can be very stubborn to treat. So they are best avoided. So when it comes to cord care, for instance, if you give birth abroad, you may just be told leave your baby alone, do not apply anything, and usually the stump will fall off and baby will do just fine. So if you give birth abroad, this is usually recommended, and you'll be told not to even apply anything. Just clean up your baby, just beat your baby, and leave that place as dry as possible. And before you know it, this storm eventually dries up, and it will now fall off, and the baby will do just fine. But if you're in our home country like Nigeria, oftentimes you'll be advised to use methylated spirit, and that is because the hygiene level, the environment, and all of these things is not as clean as what you will see in developed countries. So oftentimes your caregiver is still going to advise you to use methylated spirit when it comes to hygiene, when it comes to people touching your baby, people coming around to have contact with your baby. Oftentimes, sometimes you cannot really limit these things in our environment. So oftentimes you will still be advised by your caregiver to use methylated spirit. This is just like to be double protected. For instance, there are many surgeries you will do abroad, you will not be given antibiotics. But in our own environment, in the tiniest of surgeries, to be given antibiotics, that's because of the peculiarities in our environment. So you want that patient to be protected and you don't want that patient coming out with infection. It's similar to what is happening with cord care when it comes to how cord care is managed and being handled in our home country like Nigeria. So you'll be told to use methylated spirit, and as much as possible, you need to clean as often as possible, up to 8 times. When it comes to your baby's umbilical stump, it's one area that you need to be very, very careful with it. So before you make contact with that area, before you take your cotton wool and take the methylated spirit, ensure you wash your hands. This is very, very important because you don't want to be the one transferring germs and microorganisms to that site. So ensure you're washing your hands before cleaning. So some people will tell you, oh, as much as for every diaper change. Some people don't change their baby's diaper. Some people just change their baby's diaper just once a day. Some people change their baby's diaper just 2 times a day. So that is really not enough. So as much as you can, if it makes you setting a reminder, then that will be very, very helpful. So as much as 8 to 10 times in a day is what is recommended. Some people tell, oh, this is so much, I can't do it. Let me just stick with using the chlorhexidine gel. If you want to use the chlorhexidine gel, it is something you apply once a day, which is less stressful for mothers. However, if you discover that you've been using chlorhexidine gel for 1 week and some hasn't fallen off, it's important to stop that chlorhexidine gel and stick with methylated spirit alone. So do not combine methylated spirit and chlorhexidine gel. If you want to use your chlorhexidine gel, use it for just 1 week. And if after the 1 week it has not fallen off, you need to switch to methylated spirit. So what are those signs you should look out for that will make you know that, oh, this thing is not healing? There's something going on. For instance, if you're seeing that that side is becoming red, or the baby's stomach is looking swollen, or maybe it's having abdominal pain, or you're seeing pus around that area, don't just go and punch it and say, I want to drain out the pus. No, you need to take that baby to the hospital. These are signs that that site is not healing and baby needs to be treated for infections right away. Having been clean, it is not even showing any sign of healing at all. You need to take baby to the hospital for baby to be checked. I hope this is helpful when it comes to cord care, when it comes to how you should actually handle the umbilical stump. So see you in our next video. Until then, bye.